Today on the show, once again, my guest is going to be Dr. Bryan Reid from Edwardsville, Illinois.
Thanks for having me on the show.
Oh, you're welcome. And today we're going to talk about something that we kind of almost got into on the last two episodes.
Hard not to get
into
these days.
Is diabetes.
Correct.
So I put a question out on the Austin Family Chiropractic Facebook page earlier in the week saying we're going to have an expert on the show. Does anyone have any questions? Amanda sent me a question, and it reads like this. I'm diabetic and I feel like the meds are hurting me more than helping me. I'm losing weight and eating healthier. Other than exercise, what else can I do? So how would you address that, Dr.
Well, with the information that you gave me, it's hard to really, give her any solid recommendations. I would need more information, of course, with her health history.
Obviously.
But, because there's many different kinds of diabetes. There's type 1 diabetes, which is what we see in children, which is an autoimmune type. There's type 2, which is the most common, which I think is what she's probably referring to. Type 2 diabetes is insulin resistance diabetes, where the blood sugars are high, the insulin levels are high, and the body's tissues are just not responding to that high insulin. They've shut themselves off from letting glucose into the cell, so we have high blood sugar. There's also a type 1.5 diabetes, which is it's a combination of the type 1 and the type 2, and this is what occurs in adults now, and now they are requiring insulin to control their diabetes, just like the type 1s. And then there's a new one as well called type 3 diabetes, which is brain diabetes. And there's a gestational diabetes as well with pregnant women. But for most people, they are suffering from type 2, the insulin resistant variety. Now, diabetes is it's just an epidemic in this country. And it is estimated that I think in the year 2020, almost 2/3 are going to be either pre-diabetic or diabetic.
Wow.
And some economists have stated that diabetes will bankrupt the U.S. healthcare system as we know it. So it's a very serious issue, and the thing with diabetes is that nobody should suffer from it in the first place. It is, in most cases, highly controllable, and that is through the obvious, which is the poor lifestyle habits that we have here in the United States, and the sedentary lifestyle. So nutrition is very important in managing diabetes. There are also some less common causes with diabetes, type 2 diabetes, and that brings us back into some of the things we were talking about before with stress on our bodies and how it actually will upregulate the sympathetic nervous system, which drives that fight or flight response. And when we're under chronic stress, we are constantly dumping cortisol from our adrenal glands, and the cortisol mobilizes sugar from our muscles and our liver. And the problem is again, high blood sugar, high insulin, body no longer responds to that. And the biggest complication with diabetes is complications with cardiovascular disease. A diabetic is about 2 to 5 times more susceptible to cardiovascular disease than a non-diabetic. So when addressing diabetes, not only do we have to address the blood sugar, getting that under control, but we also need to address the cardiovascular system as well. And they need to, run those advanced, lipid profile testing, and they also need to run inflammatory markers as well. Again, a lot of the time, the standard blood tests they're not running these tests, where we're testing for not only your fasting blood glucose, hemoglobin A1C, but some other inflammatory markers like ferritin and fibrinogen, high sensitivity C-reactive protein, homocysteine, uric acid levels. Okay, if these markers are high, then we know there's inflammation driving destruction in your body, and they need to be addressed, because most diabetics, if the diabetic neuropathy doesn't get to them, the heart disease will. So we got to tie in diet. We got to address stress levels in the individual, whether it's again a dietary, whether it could be poor gut function. They could have liver issues. Okay,
Sure.
some of the medications can really back up the liver and make it sluggish. When you're not eating, the liver is responsible for your blood sugar control. And if you have poor gut health, your liver is subjected to a lot of inflammatory proteins from your diet, toxins, pesticides from your food, the medications that you're on. The sluggish nature of your liver will affect how it regulates blood sugar.
I was thinking about a book I read by Dr. Andy Wheel once, and he talked about they went to this Native American Indian place where they had never had junk food before, and they opened up like a McDonald's and they opened up like a convenience store, and all these people started eating junk food, and they had never had a single instance of diabetes in the history of these people, and then all of a sudden 80% of them had diabetes.
Right.
So
Native Americans and African Americans are at a higher risk for developing diabetes because of their genetic history.
yeah,
You're right. Again, in the history of human beings, we have nowhere in history been exposed to the sugar content of our diet. It just doesn't exist in those Paleolithic diets. Sugar, refined grains. I mean, grains have only been around for, don't quote me on this, I don't know how many, 10,000 years maybe?
Yeah, 10,000 years ago, roughly, is when agriculture began.
Right.
I was just reading a book about
Right.
that.
Modern agriculture, yes, with wheat production, corn production. So you look at most of American diets, and they're just highly, saturated with those refined carbohydrates.
Yeah, and of course now the USDA gives us a plate instead of a pyramid, but the old pyramid recommended so many grains that was no wonder that it's causing most people to become diabetic.
Right. And not only the grains, but also dairy has a big effect on your health. Toxic oils like the canola oils, corn oils, soybean oils, they are not healthy oils. I would stay away from those. Genetically modified foods have allergenic proteins within them that are highly damaging to your gut. So going back to what impairs somebody's gut health, those genetically modified foods can irritate the gut lining.
True.
There's cured meats are another thing to stay away from. Again, if you can afford to go organic, going organic is definitely better than not.
Another thing that brought to mind when you mentioned dairy is that when you go to buy yogurt, now most of the choices are low fat or no fat yogurt. And when it's no fat yogurt, it means they took all the fat out of it, which means you've got that much more carbs.
Right, they've replaced the fat with carbohydrates, which has an even more devastating effect on your blood sugar.
Exactly, so to set up diabetes down the road.
Absolutely.
So what I always do, if I'm going to eat the no fat, is I'll take and squirt some flax oil in there, so I'm adding some healthy fat back to it.
Absolutely. We should focus on healthy fats, lean proteins, alkaline vegetables and fruits. Kind of a Mediterranean diet, a low carbohydrate Mediterranean diet is what they recommend.
Makes sense.
And it's those as well, nuts and seeds, healthy oils like avocado and olive oil.
Okay. Well, thank you for the information on diabetes and the different types of diabetes and how to eat better to not go down that road towards diabetes. So thank you, Dr.
Okay.
Reid. Appreciate it.
Okay, it was a lot of fun.
And thank you for watching.